Hello, this is Dr. Jeon Inseong from Dental Bean. The patient today is a 73-year-old female. The area of today's surgery is the anterior maxilla and the upper left region. This patient underwent surgery on the mandible about 3 weeks ago. Let's take a look at the photos from the mandibular surgery. This is how the patient initially presented at my clinic. 3 weeks ago, I extracted the implant and immediately placed a new one. After placement, I attempted immediate loading with a healing cap. Currently, the patient is using the immediately loaded prosthesis. Let's take a look at the intraoral photos of this patient. This is the pre-surgery state. At that time, I adjusted the vertical dimension of the mandible. Then, I performed the mandibular surgery and took impressions immediately. 1 week later, I completed the immediate loading prosthesis. Today, we plan to work on the maxillary anterior and the upper left posterior region. The midline is here. There is a 21 tooth remaining, but the rest of the teeth are missing. The distance to the sinus is very short. I plan to place 4 implants and potentially place additional implants in the 7 area. The region from 21 to 24 has a very thin knife edge ridge. I will decide during surgery whether to use GBR or ridge splitting and proceed with the surgery accordingly. Today's surgery will use the Core 1 implant from Cybermed to complete the procedure. Here are the post-operative findings. For this patient, I extracted the number 21 tooth. Then, implants were placed in the number 22 and number 23 positions. The reason for placing behind number 27 position is that there is perforation in the remaining root. Thus, I positioned the implant on number 27. Two Core 1 implants, 4.0 by 10 mm were placed in the anterior. The implant in the number 23 is 4.5 by 8.5 mm. This was necessary because the sinus was perforated, so an 8.5 mm implant was used. The posterior implant is a 5.0 by 10 mm. The primary stability was good and I don't foresee major issues. For the number 22 and number 23 implants in the anterior, I used the wide cover cap from the universal kit during surgery. Let me briefly summarize the bone graft materials used. In the posterior sinus area, I used InnoFuse S, a DBM-based bone graft material. InnoFuse S contains DBM combined with inorganic bone material, making it a high-quality DBM graft. For the anterior, I used xenograft material, InnoSS-B, to perform GBR. Let's take a quick look at the CT images for this patient. This is the number 21 area. This is the post-operative view of the number 21 area. You can see significant bone adaptation on the buccal side. Next, this is the number 22 area. This is the preoperative view of the number 22 area. Post-operatively, you can see that the bone has adapted well. As expected, precise drilling played a critical role. For the number 23 area, the sinus was shallow, so I placed an 8.5 mm implant. Post-operatively, the bone appears well adapted. For the number 27 area, the remaining bone height was about 2 mm. The sinus lift was successful and the implants are stable. I expect to finalize the treatment in about 6 months. I will provide an update at that time. Thank you.